10.8. And this is a little girl.
Val, I love that we have dinner served in the front of the clinic. Val and I heard that dinner was served over here.
Yeah, we got some corn.
Can we have 2 dozen?
Yeah,
Val, my treat.
absolutely.
Hey, what did you find?
Little caterpillar.
May I hold them?
Yeah.
Look how pretty. Do you know what caterpillars become?
Butterflies.
Butterflies, right?
Hazel wants to be an animal doctor.
You do. Yeah, this is a great start. Awesome. This looks delicious, guys. Thank you so much.
Thank you.
Take good care of your caterpillar.
I could eat a whole supper with sweet corn.
Well, I think you might be on your way.
Here.
Hi.
Hi.
How are you? Hi, Raider.
Good, how are you? Hi.
This is a new baby for you.
Yes, it is.
Well, congratulations.
Thank you.
Today we have Raider, who is a senior Shar Pei, who was just recently adopted from a bad living situation. They're not a super common breed. We don't get to see a lot of these dogs.
There we go.
Hi. Oh my goodness. Shar Pei puppies, they're born with all the skin they need to be adult dogs. So as they grow, they get a little less wrinkly because they fill out. It's kind of the opposite of people, where we look real nice and not wrinkly as babies, and then time happens and we get real wrinkly. How are things going with him as a new pet?
He's doing really well, getting along with most of the other dogs, but he's got some eye drainage.
Oh, darn it, buddy. Oh, you are runny-eyed. Okay. This is really common in Shar Peis because they're like giant wrinkles. You see how the eyelid is completely rolling in and how all those little hairs are just rubbing right on his eyes? He has what we call entropion in that lower lid. Entropion issues in Shar Peis are really, really uncomfortable. It's like having sand in your eyes all the time. It's definitely not something you want to continue to have happening. If you think of the eyelids like a window shade, they should come down, and the back of the window shade should be what touches the eyeball. But in his case, the window shade's all rolled up and all the hair is rubbing there. That's what should be normal. You can see how much I have to pull down to get that to roll out. Obviously, that's pretty uncomfortable for him, so it should really be fixed. A lot of times with older rescue animals, they've really had minimal care or have suffered some sort of neglect. Clearly, we need to address these eyes. These are so uncomfortable for him. He's a sweet old grandpa dog, and I'm really happy for him that Ariel found him, because now finally we can provide him with some relief. Really, the solution for his eyes is what we call an entropion surgery, where we actually take a little wedge of tissue from below the lids out, and then we kind of tack that out so it makes those lids go straight. We remove a little bit of the window shade. So is that something you think you'd like to do?
Yes, absolutely.
I would like to put him on an oral antibiotic because all of his eye drainage, we have a little bit of infection there. I want that skin underneath his eyes to be as healthy as we can, because that's where we're going to do surgery.
Sounds good.
What do you think?
You excited?
It'll be a whole new lease on life for him. Yeah?
Raider's a sweetheart. I'm not sure what kind of life he's had, but I just want him to have the best life moving forward.
His face will be a little less wrinkly, but in a good way.
You're sure getting fed well.
Hello. Hi, Todd.
Hello, Doc.
Well, you brought me a box full of cookies or what here?
That'd be nice, wouldn't it?
What is in here?
There's a little baby guinea.
Oh, guinea hens are so useful around the farm. They eat all the insects, they eat ticks. And this is pretty rare because I don't get a lot of guinea hens that come in as patients. So it's gonna be a treat to treat a little guinea hen today. I can see the problem from here. It's got a bad leg, doesn't it?
Yes, it does.
Going the wrong way for sure.
Definitely going backwards. I bought a dozen guinea hens for the grandkids to grow up with and take care of. And my grandson noticed that one of the legs was turned at a right angle from the other leg.
Was there a predator involved that you know of?
Nope, not
No
that I
way.
know of.
I know. See, that leg is totally going the wrong way. It's not wobbly. It's very solid, but I think I better get an x-ray before I do too much manipulation.
Okay.
Okay. Anytime we work on a bird, it's a two-person project. Hey, honey,
Okay. Yeah.
I need some help with an x-ray. I've got a guinea.
Does the little bird have a name? It will
Not
after
yet.
today.
I want to name it Winnie the guinea.
That leg is doing like
wrong.
5th position ballet. Yeah, what's that?
The x-ray shows a pretty bleak picture of what happened here.
Hey, how are you?
Pretty good, Erin.
Cute baby bird.
It is. I named this guinea Winnie, just so you know.
Winnie the
If that's
guinea.
all right.
That's fine.
We found an answer for you, too. You can definitely see the normal joint on the other side. And that's how that's supposed to look. And this one is a total dislocation. Right at the knee joint or the stifle, there's a dislocation. I think what we would like to do is to sedate her totally under general anesthesia, just with some gas. And then she'll loosen up and we can manipulate these bones and pull them back into place. Okay. And then we'll put a little splint on her leg just to hold everything in place. Okay.
Yeah, that'd be fine.
All right.
We'll give you an update.
Okay, thank you guys.
Thank you.
There you go.
Are y'all ready to have fun on a Friday night? Let me hear y'all.
All right, you ready to sweat a little?
I'm always ready to sweat.
Sweat your meat and potatoes off.
I got more meat and potatoes to sweat off than you do.
Hello, Ben, Erin.
Chuck, is it okay to come in there?
Yeah.
We got a call from Chuck Cottle.
Who is a great client. He was a client of your dad's.
He's an awesome guy. Sounds like you got a problem with the bull.
Yes, I do. I got a fight with the other bull. Threw him through a fence over there,
Yikes.
which takes a little power to do that, snap it in half.
They call it bullying for a reason.
Yeah, they do. I've had this bull approximately 3 years. He was a yearling when I bought him. He's one of my bulls that I use for breeding cows. I've never had any problem like this before, ever. He's not real lame yet, but he's got a lot of swelling there in the back end.
Well, let's see what kind of damage he did.
All right, well, I see him.
Oh, yeah.
Is that the spot?
Wow, that's a swelling.
Yikes, Chuck, that's huge.
That's a hip. That looks like a big old swelling. It could already be a big abscess if something poked in there. It could be just a big bruise with a bunch of blood clots. Whatever it is, it's full and it's full of pressure. If we don't drain this, you know, that could definitely get systemic eventually and make this bull really sick. If we can get him better, then he should be able to go breed some cows this year.
Yeah.
I think he just heard he gets to breed cows.
The first thing we need to do is get this bull behind a gate so I can give him a dose of sedative.
All right, Wilson, little poke.
And then we're gonna make him lay down, basically, so we can work on him safely. Now we'll open it up and let him go to sleep.
And I'll walk him out of here.
Sweet dreams, Wilson.
We've got to have him fall so his big lump is up. Sometimes these bulls just need a little bit of help to fall on the right side. So I want to put a rope around his left leg, pull it underneath him, and that should get him to fall in the correct position.
Oh, I see. You're gonna help him. Yeah.
I think there's like a ninja move like that, like the leg sweep. So you're a bull ninja?
Sure, always have been.
Oh, there we go. It's kind of the way you wanted it, right?
That's perfect. You don't happen to have a sweatshirt or a coat or something in your truck, do you?
Yeah.
Let's put that over his head so he
Oh,
can't see what
okay.
we're doing.
Yep.
Stay down.
Cover him up.
Yep, cover up his head. This is the bottom of the swelling, Chuck, so this is where we're gonna wanna make our incision. That's a bruise, I think. See all that dark? That's a big old bruise, also known as a hematoma. What do you always call them, a hematomata?
A hematoma. This one's like a hemata watermelon. A hemata prize-winning pumpkin.
We've got to find out what is in this huge swelling. The best way to do that is to first insert a needle and see what kind of fluid is in there. Oh yeah.
Bloody?
He sprung a leak.
This is a big old seroma. A seroma is really a big pocket of serum, and it's usually caused by really, really hard blunt force trauma, which is exactly what this bull had happen to him. So we want to make a nick in it with a scalpel and just make a nice drain hole for it.
Yeah.
I'm really hoping that draining this will do the job, but who knows what else is in here. Here we go.
Oh boy.
Oh, wow.
Wow.
That's got to feel better though.
Oh yeah. We got to it right before it turned into pus. Yep.
There's some blood, there's some serum, there's blood clots, there's fibrin clots, which is the body's way to try to close this all back up and make everything go together.
I've never have had any been like this before.
You've been doing this a long time, Chuck.
And I
That's saying
haven't had
something.
that problem.
Chuck, this would potentially cause death.
Oh, I'm sure it would, yeah.
He kind of had a mixture of a seroma and a hematoma all at once. And if you wait long enough, that can become an abscess. But Chuck had us out here in a timely manner. If he would have let this turn into an abscess and potentially get systemic throughout the bull, this bull could be dead. So this was the perfect time to get this drained, get it out of his system, and let him heal up.
So you don't have to go all the way up in there to get it all out? or do
No,
you
because
just...
I made my cut at the bottom of it.
Yeah.
It'll drain.
Okay.
I would say at least 2 basketballs worth of fluid in there.
Yeah.
Look at that.
Yeah.
Now that we've got it lanced, we've got a majority of the clots out. We need to treat this bull with some antibiotics, flush that wound out the best we can.
Give him some pain medication and then wake him up. He's a big bull and he needs to be up on his feet here ASAP.
I think it's time to wake him up.
Yep, I think he's ready to get up.
Good boy.
Morning, Wilson.
Come on, Wilson. I'm gonna leave this incision open to drain, because if I were to suture it up, it would trap all that infection in. We want it out, not in the body.
I feel like he kind of looks like you getting out of bed in the morning, Ben.
There we go.
Come on.
There, oh, yep, there we go.
There we go. Right out the door. That'll wait. Now don't fall. Oh, now you think they'll pick on him?
Uh-oh.
Get out of here. Get over there.
We've got to get Wilson from our pen to the other pen without the other bulls really being bullies again.
He's looking at you, Ben.
Get over there with your buddy.
They know that he's a little bit weakened, he's a little bit sedated, so we've kind of got to play keep away.
Come on, Wilson.
Heads up,
Your
heads
turn.
up. He's squaring him up, Ben. You cut it out.
Come on, Wilson. Trying to help you. There we go. There. You guys stay in here.
I think this bull got really lucky and he's gonna go get more lucky.
Whoa! She said it. Let's load all our stuff up and get out of your hair.
Okay.
Keep us informed. Let us know how it
Yeah,
goes.
I'll let you know. I wouldn't be doing this if I didn't love it. Yeah. I would have quit a long time ago.
Say no to bullying.
Idea.
Look at them. They're having fun.
Hey, boys.
They got their little first mate down there.
Happiness. You guys catching anything?
A farmer's tan.
Why don't you take the boat out?
You guys got enough fish for supper?
I don't want to lie to you.
So no?
No.
Looks like you guys need to take a little float with the dog.
I'm down for that.
I'm jumping in too. I bet you're gonna end up right there
I'm
reading
gonna
a book.
hang out in my hammock with a book. Deal?
Deal. Come on, Winnie. Let's go fix you up. Today's the big day to fix Winnie's dislocated knee.
Go ahead and get some anesthesia going.
A dislocated knee on a guinea isn't the easiest thing in the world to get placed back in. You ready? We've got to be very, very careful. If we pull too hard, we may break a bone. You also have to be very, very strong in your movement to get this pulled apart and put back into place.
Think she's sleepy?
Yeah. We've got a young, immature bird under general anesthesia. We've got to move quickly. I'm gonna push down, you pull the leg out and rotate it around.
That's back in line.
Is it?
Mm-hmm.
What do you think?
I feel like that doesn't look very good.
Maybe it got its leg caught in something. Who knows here? Just doesn't want to go back in. It's not gonna go. Look at all the hemorrhage there.
Yeah.
There is so much swelling in and around this joint that the joint capsule itself is obliterated. Unfortunately, manipulating the joint and replacing it is now not an option. This isn't going to work. What are we going to do?
I really think that the only option that we have is to probably amputate this leg, Ben. Do you want to go call Todd?
Yeah. It's like when you're trying to put a nut on a bolt. Hey, Todd, thanks for answering. And the threads are just stripped. I think we need to go to amputation and try to remove this leg and give her a chance. There's no way that that'll ever hold again. So we got to go to plan B.
Their skin is so fragile, thinner than chicken skin.
There's no way that an animal can live with a dislocated leg like that. So we're going to give her a chance.
We've got to move quickly because no bird can be under anesthesia long. They get very hypothermic. They could just quit breathing.
Whatever happened, I think there was a lot of
Trauma.
trauma and swelling.
Oh yeah, look at all this. This is huge hemorrhage.
Okay, well, that was quick.
There's the leg. We've got Winnie through the hardest part. Okay, 2 more stitches and then we're done. She just needs to rest and recuperate now. Hey, you. Oh, there's your eyes.
Hi.
I saw you. Winnie's all done with her procedure, so now she gets to go home and recover at the grandkids' house.
Well, on a good note, she's so young that if she can adapt to this, she's not really going to ever know the difference.
Nope.
You know, I mean, this is going to be the story of Winnie the Guinea.
Hey boys, Dr. Erin and Ben are coming.
We're making a delivery here to Val's house, which is actually where I grew up.
Hey, Val. Hi. Hi, boys.
Guess what we have? It's a basketball hoop.
Awesome.
Brought a ball for you here, too. Here you go, bud. Yep.
Wow, what do you say, guys?
Thank you.
It makes me a little sad that Chase and Charlie are kind of on to the next phase of their lives, but I'm really happy that I can help another mommy see her kids go out and do all these great things.
We knew you didn't have a basketball hoop here anymore, and Charlie and Chase have kind of outgrown this.
Well, thank you very much. I know if they don't use it, I will.
Yeah.
Here you go, you ready? All right, oh, he's got it. Okay, let's get this thing unloaded and get you guys shooting. Just walk it up.
Good job, Connor. Good job.
Grrr.
All right, ready?
Throw it through hard. Oh! I used to play basketball as a kid right in this driveway.
I think they're gonna like it.
I do too.
Keep them busy at least for a half an hour.
So it's kind of bringing back some really good memories. There it is. There it is.
Good job. Atta boy.
It's where we got married. I walked under your old hoop out to meet you at the altar, honey.
That's right.
Thank
All
you
right.
guys so much.
Enjoy, guys.
Christmas in July.
Yeah.
All right.
Thank you.
Bye-bye.
Use your legs. Jump high. There.
Are you gonna shake? Oh, hi, sweet boy. Do you shake your other foot? Or just this foot?
Oh, he will when he puts
shake?
it down. There you go.
Oh, good boy.
Come on in. And you got a horse in there, huh?
Yeah.
All right. We'll just stop you right when I say hold your horses. That looks great. You did promise you had a miniature horse.
I did. Charlie.
All right. Charlie horse.
Yeah, I didn't think of that when I named him.
Oh, he's beautiful.
With Charlie, as soon as me and the dogs go out the back door, he is pulling at the gate because he wants in the backyard with the dogs, and he chases them and runs with them and plays with them. He thinks he's one of the dogs.
Come on.
Come on, Charlie. Mama's got a treat. Come get it.
How'd you get him in the trailer? Treats?
Yeah.
And I pushed a lot. Usually he's full of energy and running around. He's walking really slow. He has trouble getting up.
Oh, here he comes. Come on. There he goes.
Mama just got to nudge you, huh? He just seemed to be getting worse, and so it was time to bring him to the vet.
His feet hurt him a little bit, don't they?
They might.
It really looks like he's turning that leg a lot. He's just not himself. He's not spunky. I get the feed bucket. He doesn't run with me. You're okay, buddy.
Good. He's got a strong heart rate. Now, it is a little fast for a horse. That could indicate that he's in some pain. Okay. Let's see if he's running a fever. Oh, Charlie, he's not used to this. I don't know if anybody's used to this, but
Yeah.
got him.
Okay.
99.9, so he's sitting right in the middle of normal. It doesn't look like we have an infectious disease going on here.
Okay.
What I do see is a Charlie horse here that doesn't want to move his feet. It looks like they hurt. Get my hoof testers out and we'll try to see if he's sore on his feet, you know, when I kind of pinch him.
Okay.
Especially his front feet.
His front feet.
Yeah, a horse carries 60% of its weight on the front feet.
Okay.
That's usually where they show some tenderness or soreness. Now I'm gonna squeeze a little bit and see what happens. He didn't like that. His right front seems pretty painful.
Okay.
Let's see it on his left side.
Okay, I'll switch sides with you.
Charlie, can I have
Good
it?
boy. Good boy.
Oh, that hurts, that hurts. Okay, it's okay. Ah, easy, easy. I don't have to keep doing it. I know exactly what's wrong here. We're done making it hurt, Charlie. Thank you. Thank you for hanging in there with us. I know you guys haven't owned horses before. If I say laminitis, does that ring a bell?
I know it's a hoof thing, but I don't know exactly what it means.
Well, it's basically inflammation of the feet.
Okay.
And I think that's what we have here. We have a hoof that when it gets inflamed, there's nowhere for that inflammation to swell to, right? It's trapped in a hoof capsule. So his pain, it's like, oh, it's like if you hit your nail with a hammer and you've got all that swelling underneath your nail. It has nowhere to go. I really think I know what's going on with the inflammation here. Let's get him weighed. But I want to get Charlie on the scale and just confirm it.
There you go. Okay. Got one more foot to get. There.
Perfect. Holy cow.
Holy crap.
314 pounds.
That's way more than I thought.
Yeah.
He's got to lose about 40 to 60 pounds.
That's a lot of weight, Charlie boy.
I can tell you why it happened is because of his diet. Anything with a high sugar load, like beautiful green grass in the yard, when they can't metabolize all those sugars going in, it makes a crazy thing happen in their hooves.
So you don't buy a mini horse to mow your yard?
Nope, you don't.
Every day, he gets the long grass out of the front yard, an apple and 2 carrots. He gets field corn sometimes, and lots of treats.
They're miniature for a reason. They need to eat a miniature diet.
Okay.
He gets fed an appropriate amount of hay twice a day, and that's what he gets to eat. I would even cut out the horse treats.
Okay.
Okay.
I know most people spoil their pets by giving them lots of treats. I'm guilty of it too. But it can lead to increased weight, which is a big health concern. He's not going to want to exercise until his feet feel a little bit better. So we've got some pain medication. It's just a little tiny tablet once a day, and that will start helping him feel better and wanting to exercise.
It is kind of tough because you want to give them what they want because you love them so much. But if it's not healthy for them, then I have to cut back. Truth be told, my husband Todd gives way more treats than I do.
And I'm going to check in with you guys, I promise, and we're going to see how much weight we've lost, okay?
Okay.
I'm going to check in on Charlie in a couple months. Next time I see him, hopefully there will be less of this little miniature horse. It's the weight loss program for you, big guy.
We've got some new toys for you guys. Here's a one. You want this one? Oh yeah. You like this one, Doris? Nope. Like that one? Meh? That one? No? How about this one? No? Are none of these toys good enough for you? Definitely not that one. You're a lot more picky than Zoinks is.
Hi! It's Raider. Hi, Raider. How are you? Raider's back today. He's an aged rescue Shar Pei that's here for entropion surgery. All right, so there's 3 little pokes, bud. All right, tiny poke. Boop. Entropion is where the outside of the eyelid that's all hairy is actually rolled up under and rubbing on the cornea or the eyeball itself.
All right, you get to go rest on those and then we fix your eyes, okay?
These eyes, they are definitely ouchy. To do an entropion surgery, we're gonna take out a little sliver of tissue wherever we have rolling eyelids. We're gonna take out a piece till they go straight and then suture that down. You'll be able to see all the kitties, chase them extra fast. Without surgical correction, we can develop chronic scarring and dogs can even lose their sight. All right, you got front, 1, 2, 3. So Val, this is probably one of the worst cases I think I've seen. You know, he is just rolling in. We're gonna take all this skin from under here out. I wanted to make him look comfortable, but not have the look of permanent surprise. The technicality of the surgery is not tremendously difficult in all of the different surgeries we do, but it's very, very detailed. It's very fine work. All right, big guy. So I'm putting this clamp on here. Kind of makes a nice little crimp in that tissue. And he's got so much tissue. Take a little bit more there. So I'm just cutting this tissue away. So I'm gonna put in a couple stitches and see if I like what I've done. Okay, I'm liking this. It says, my eyes feel better. We've got the first eye done, but now we have to do the other eye, which is actually his worst eye. This eye has rolling in the upper lid, the lateral canthus, or the outside eyelid, and the lower lid almost makes a full roll and a half. So we've got to take a lot of tissue out to really get this eye so it's comfortable. I'm just going to take all that tissue to get that out. The trick with entropions is that if we don't take enough tissue, once they wake up, the eyelid still rolls in. But if I take too much tissue, then I could give this dog ectropion, where the eyelids roll out. It can allow excess dirt and debris to get into the eyes. I hope we get this right for him. Okay, I'm about to do the ouchie. Buddy, hang in there. This is extremely severe, this rolling in of the tissue on 3 different sides of his eye. Nope, that's still rolling. So I'm gonna be a little more aggressive because I want this to be the final fix for Raider. Trying to give you a very cosmetically lovely look here, bud. I'm trying to pull back the outside of the eyelids because those were even rolling in. You really have to take into account a lot of the different forces at play with the skin and even gravity. So it's really important to stay focused. Last stitch, Val. Gonna make him look 20 years younger. We have so much tissue swelling that's going to happen. So what we see while he's laying here versus what we see in a couple weeks is all going to be different. There you go. His face looks a little rough, but I can see his eyes, and even under anesthesia, you can see he's starting to see things around him that I think he hasn't seen in a long time because his eyes have been too painful to open. It's a pretty neat feeling. Deep in my heart, I know that I've helped this dog. You done good, Rita. Rita's just lost eyeballs.
Hey, Caitlin, could you help me a minute? I've got something out in the truck. Sure. I'll show you here. It's amazing he's even alive.
Oh my gosh. That is the absolute cutest baby deer that I have ever seen.
I think he fell off a cliff up at Lewis and Clark Lake. He was laying down, not moving very much. We had to climb up quite a ways to get him. During the early summer, we get a lot of calls about baby wildlife being abandoned. Today was a really hot day for that fawn to be on the cliff.
How high do you think the cliff was?
50, 60 feet. My son works for the Game and Parks. He climbed up the cliff and he brought it down and we headed straight here.
Great news that he's even standing.
I noticed his nose is pretty dry.
He's definitely dehydrated.
Why don't you look at him, give me a call.
Absolutely, will do.
Thank you. I've worked with Dr. Ben and Erin before.
Let's go get you fixed up, bud.
They were able to help me out and house these animals temporarily until we can find a permanent home for them through wildlife rehab.
There we go. Get you some fluids, buddy, and get you fed. This little deer has been in the heat all day, so we want to get him rehydrated with some fluids, try to make him normal again. This is going to be your go-go bag. It's going to make you want to go-go.
Look at this old hot rod.
Yeah, that's pretty cool.
That's very cool.
Hey, guys.
Hi, Docs. Today we came out to Todd's place to check on Winnie the Guinea.
Winnie the one-legged guinea.
She's in there somewhere.
Is she tough to tell apart from the other guineas?
Yeah, except she hops on one leg.
She has the strongest leg in Cedar County, I bet. Well, I'd love to see her if you want to go in and get her.
Okay. I got her.
Got her?
Hi, Winnie.
Oh, wow. Bring her on out.
Look at her.
Wow.
She looks great. So have you been taking care of her all by yourself?
Yeah.
Yeah?
Can I hold her?
Yeah.
All right, don't lose her, Ben.
I'll try not. Come here, Winnie. Erin, take a look. Does it look all right?
That looks so good. There's no scabbing. Oh, it's okay. You did good, Winnie.
I tell you what, I've never done this surgery before, but it looks like it worked out.
Yeah, it
Yeah.
did. I was really surprised.
Thank you, Todd, for taking the time and bringing this little baby in because it needed help.
Yep.
It did.
Thanks.
You're welcome, Grady.
I think Todd wins Grandpa of the Year.
Todd's grandkids love their animals, and you can tell it's rubbing off on Grandpa. It's really the kids that sometimes teach us all about humanity and really about taking care of all creatures great and small. Well, you guys, Winnie looks so good. I'm gonna put her back in her enclosure. Open up the gate, let's put her back in there. I wanna see how she gets along with the rest of them. Look at that.
Oh gosh, Caitlin.
He's trying to run.
Are you trying to run away?
Our local conservation officer, Jeff Jones, got a call about a fawn who had fallen off a cliff. Caitlin has been triaging it, and now we need to really get some nutrition in this baby. It is a little girl. It's a little doe, so we could name her Jane Doe. Look at you go.
Jeff didn't know if it was injured or not, but it was super dehydrated.
Okay,
He was out in the heat for a while.
you got some fluids into it?
Yep, we got fluids in.
We might get it another bottle here, my gosh. We need to make sure that we address hydration and nutritional status. Okay, do you want some more milks? Is that good? You want some more? This is a young animal, so if we don't keep blood glucoses up, we could be in really, really hot water. Obviously, I'm really concerned if it fell off a cliff that we have any sort of head trauma, fractures, broken legs. There's a lot of blunt force trauma that certainly could have happened. We need to find out what, if anything, is wrong with the animal. Can we take a listen, my dear? Caitlin, everything sounds great. There's no crackles, wheezes. But now that she's gotten some food, I feel like we're stable enough. Let's go do an assessment on her. Let's go see if you walk, okay? This was a big fall, and sometimes things take a little while to show up.
Did you take a big tumble? Lose your mommy?
We don't know if she'll be able to even walk. To the eye, obviously she can stand up, but I really want to make sure we don't have any deficits, potentially even some nerve damage, something like that from her fall. So here, Jane Doe. Okay. Oh, she looks pretty good, Caitlin. She's going about 100 miles an hour. I'm shocked to see that she's in such good shape after having such a big fall. So when I flip her foot onto the back, she should pick it up and recognize that's not the way to place her foot. Jane Doe's able to walk, she can place her feet, her eyes are bright and clear, she's making little fawn noises. If I were to have put bets on how healthy this animal would be, I would have lost.
Erin, I just got a text from Jeff Jones.
This is the deer.
She's the cutest thing ever. What is it about these little baby fawns that just gets you right here?
I don't know.
Don't you think we just need to take an x-ray? Just to make sure that everything looks okay?
Yeah, I think that wouldn't be a bad idea, just to make sure we don't have anything that we might be missing or any free fluid in her abdomen or her chest, just to be sure.
Yeah.
Jane looks good right now, but anytime we have massive trauma, we can have slow bleeders in the brain, we can have cranial swelling, just like if a person hits their head. Sometimes they look normal at first, and a few hours later, they have seizures, they're in a coma, or it becomes an extreme emergency. Looks like she might have a little tiny contusion.
Where do you see it?
Just right here.
Oh, yeah. Her lung doesn't seem to be allowing as much air as it should right in that area because of the big bruise. Back here, it's fine, but up here, it's a little bit worrisome. Little baby Jane is a wild animal, and they are the best at hiding their injuries from humans.
Yeah.
That's what they're designed to do, is hide those injuries so that we don't know that they're hurt. I think the best thing to do is just keep her calm, monitor her oxygen a little bit here and there, and just make sure that she looks like she's not panting, because that could be from lack of oxygen.
We can be deer mom for a day or two, but really, this is gonna take a pretty big team to keep Jane Doe moving forward and living her best life.
You lay down, sweet girl.
Hi, Doc Ben.
Hi, guys.
Thanks for coming out.
You betcha. How are you?
Doing good, doing good.
Good to see you. How is Charlie doing?
He's doing so much better, a lot happier, running around a little more.
Mary and Todd invited me here today to recheck Charlie, look him over, and make sure that he's lost some weight. He was not good there for a while,
No,
was he?
he was not.
He was well over 300 pounds last time we weighed him, right?
Food is love, right?
What are you feeding him now?
Mini horse feed and alfalfa.
So basically, you've lowered the carbohydrates and upped the protein.
Yep.
I want to see Charlie. I kind of miss him. And I actually grabbed the scale from the front of the clinic, and we're going to go ahead and re-weigh him and just see how his weight is doing. You mind helping me get the scale?
You bet.
All right. Last time I saw Charlie, he had laminitis or founder, and his feet were growing out. The more weight that Charlie can lose, the better off his feet are going to feel. There he is.
There you go, Charlie. Good boy.
Watch your head.
Last time we weighed him, he weighed 315 pounds. Look at that.
Hey, Charlie.
286 pounds. He's lost 30 pounds.
Yep.
That's incredible, you guys. You know, I can tell he's starting to get his waist. He looks great.
That's good boy, Charlie, see?
This really brings some relief to me because I was pretty worried about Charlie. He was overweight, his feet weren't right. I really think that Mary and Todd did a great job of helping him lose that weight. All right, you guys, my work here is done.
Thanks a lot.
You bet.
Come here, Raids. Hi, Raider. You guys are here to see the doctors for a recheck?
Yes, do a checkup.
Go right in.
Okay, thank you.
It's been a month since Raider's eye surgery, so today he's coming in for a recheck. I'm so excited to see him, and hopefully he's excited to see me too.
Hey, Raider. Hi. Look at you. You have eyeballs.
Definitely seems a lot more active.
Yes, he is. He runs around more and he explores a little more. I love watching Raider run around. It makes me so happy. He's just living life unfazed, exploring, doing his thing, and that makes all of us so happy.
Yeah, he looks really good. I mean, there's like legit eyes in there.
Yeah, so much better.
There we go. The first time we saw him, he just came in and he kind of kept his head low and didn't really interact. So I'm absolutely thrilled. I feel like he really is a different dog. That's all we want, buddy. I think you hit the new home lottery here. All right, well, thank you so much for bringing him in today. You did good, pup.
Thank you.
Yep.
Take your kids to work day. I love it. The boys are here with us today, and I think they're going to be pretty pleasantly surprised with what's going on. Come on down, guys. We have something to show you.
We're going on a field trip. It's gonna be way worth getting out of bed, guys. They're gonna take a little trip with us, so we got something up our sleeve.
Jane, you ready to go to your new home? Wow, you got some energy today.
This little fawn made an amazing recovery. She's completely healed up from her chest contusion. She's oxygenating normally. It makes me feel happy to do what I do. This is one of those mornings.
Look at here, guys.
Hey, what's that doing? Oh my God.
Isn't she cute?
Oh yeah.
Yep. This is Jane Doe. Jeff Jones brought her in. She was really dehydrated, but she was super lucky. There's nothing wrong with her.
Today's the day she gets to go to her forever home.
Yep. We're gonna take her down to a rehab center near Omaha.
So, where's this Jane Doe riding?
She's gonna sit between you guys.
Here you go. You better practice holding her.
Oh my
Yep, she kind of tries to jump. She's a little like a bunny.
All right, you guys, let's get loaded up. We have a 3-hour trip ahead of us. Here's hoping that little Jane Doe can find a new family, really start growing and living her life.
Seatbelts on.
Yep.
We're here, guys.
We made it.
Hi.
Welcome to the safari park.
Thank you very much.
I hear you brought a package for us.
We did.
Yeah, we have a 3-week-old fawn, roughly. We rehydrated her. We've been feeding her, but we heard you guys have a small deer herd and that you'd probably be willing to try cross-fostering her and getting her a mom.
Absolutely. Yeah, they always do better without hand-raising them. We have a herd of 3 females with 6 fawns, so they all had twins. They can easily take on more, so I think it'll work out real well.
Excellent.
Well, fingers crossed this works.
Fingers crossed.
So what hopefully takes place here, our little baby Jane can come over and start nursing. That's really the first bond or the first touch that needs to happen. And from there, sometimes nature just takes its course.
How do you propose we introduce Jane Doe here to your herd and to your mamas?
I have one of them locked kind of inside the barn in an outside corral. We brought some treats to keep Mama occupied and so she can slowly realize what we're doing. Sometimes it takes a little bit, but as long as we do it slow, it'll be one big happy family.
They'll live happily ever after.
Yeah.
Well, it's worth a shot.
Boys, you ready to bring Jane Doe out?
Yep.
That's really a pretty intimate moment between a mother and a baby. And a lot of moms say, no, 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 that's not your food source. And you go away and find your own mom. And here she is.
No, she looks very healthy.
She's beautiful.
Yeah, well, let's head in.
Okay.
Nursing is really the crucial moment for this bond to happen. So if that happens, I feel like we're well on our way. There she goes.
That's the wrong end.
She has to relearn it a little bit, doesn't she?
Did you find it?
She figured it out. Yes.
I think she got a taste, Gary.
Oh, yeah.
I do too.
She's like, now where'd my mom go?
I've seen this work in other species, but never a white-tailed deer. You know what, guys? I think Jane found her home.
This is awesome. I feel like we just hit a home run.
This is a home run, a touchdown, a goal all at once.
This would give maybe them a great chance to see if they can sort of solidify that bond. So let's just give them some time alone.
Sounds good.
It hit me in the heartstrings. I've got my kids here. Yay! There's just something special about seeing that bond between a mother animal and their baby. This deer just said, "You're my baby now." I think that's pretty cool.
Mm-hmm.